Hi, my name is Wendy Lee. I'm one of the pharmacists here at Hawthorne Pharmacy on Taylor Street. Today I'm going to talk to you a little bit about stress and the effects of stress and some things that how we can measure it, and also some things that we can use to help with our stress levels. We do know stress affects every single portion of our body. In fact, 75 to 90% of doctor visits are related to stress. Because stress has become a normal part of our normal lives, some people do not realize the impact it has on our bodies. Stress has short-term effects and it has some long-term effects. Some of these long-term effects can be an increased risk of type 2 diabetes, heart problems, high cholesterol, high blood pressure. Some of these things can definitely be related to stress. Also, hormone imbalances, which we find and we help with patients. Hair loss is another effect of chronic stress. We do know that there is a stress hormone called cortisol. And what happens is in the morning, your cortisol levels are going up. That's what kind of wakes us up in the morning. And then at night, your cortisol levels go down. And that is what helps us go to sleep when your cortisol goes down. We can actually measure cortisol levels with our hormone saliva testing we have here at Taylor Street. So we can see your levels to see, how much stress you're having. One thing we know, there are a lot of things that we can do to help stress. There's a lot of non-pharmacological things we can do to help with stress. Number one, getting adequate sleep, going to bed on time, trying not to keep the TV on all night. Definitely turning all devices off before we go to sleep. It's very important. Also, exercise. Exercise helps with stress, especially exercising in the morning. A lot of people, find if they exercise at night, they can't sleep, and it's because their cortisol levels are all rammed up. So exercise in the morning is definitely a good option for a lot of people. Massage therapy. Meditation, going to a therapist. A lot of these things can definitely help with stress levels. Another thing, there are some over-the-counter supplements that we recommend for stress. A few of them that I recommend very frequently to hormone patients. Fish oil is a great, what they call cortisol modulator, so it helps with stress. Also, L-theanine. L-theanine is actually derived from green tea, so if you don't like taking capsules, you can always drink some green tea. Green tea does have caffeine in it, so be careful. If you have any heart issues that you shouldn't have caffeine, I don't recommend green tea. And obviously you don't want to take green tea right before you go to bed unless, if you have any sleep issues. So definitely in the morning, green tea, okay? Few other ones, I recommend magnesium. Magnesium is a wonderful mineral. It's actually kind of helps with three things. Helps with sleep, helps with anxiety, also helps with pain, and also can help with constipation. So if you're having any of those symptoms, a lot of times magnesium is a great option for you. One trick about magnesium, if you start getting diarrhea, that's usually a sign you have too much. So you need to back off on magnesium. Besides supplements, we know you can definitely do the non-pharmacological things, but a lot of times we have to use the combination of the two. So if you have any questions about stress, or if you're interested in finding out what your cortisol levels are, please give us a call. Our phone number in the lab here is 803-227-4452. But we hope we have a wonderful holiday weekend upcoming. Labor Day is this Monday. Make sure we are going to be closed on Monday, so make sure if you need to get prescriptions, go ahead and call them in today. Today's Wednesday, so go ahead and get them set up so you don't have any stress over the weekend. But I hope each and every one of you has a stress-free weekend. Y'all take care.